So if you think about flattening the curve and reducing the number of new positive cases, and here's the next chart is the infection rate percentage of the people who tested positive, and gives you a better idea of the peak and then the flattening of that curve, and we'd like to see that go down even further in the days and weeks ahead. We also look at personal protective equipment as part of the dashboard, whether the glass is half full or half empty or completely full, and all the glasses have been completely full for some time now. We are conscious of that as we move into the fall, both with respect to nursing homes, hospital personnel, as well as school personnel, and the availability of glasses and surgical masks, face shields, gloves, N95 masks, and the like. Moving into the work that Dr. Bunting's group did, working with superintendents and principals and educational leaders and teachers around the reopening of the schools. They identified, working with the experts at the public health, our two top physicians that are with us today, the conditions on the ground that would allow the reopening of the schools. First is scenario number one, which is the green scenario, minimum community spread, and we'll talk about the criteria there. Very limited number of cases, hospitalizations, percent positive. Minimal to moderate is yellow. We've been in yellow now for some number of weeks and continue to improve in our current situation there. We do have one of the three criteria, the hospitalizations, that is in a green, but the other two are yellow, and so they allow districts to make decisions to open with a hybrid or a mix of remote learning and in-person instruction. And I know superintendents and teachers and staff have been working hard to identify just the way to do that. And then red, it's significant in that we're not really close to red. We've been in red before, back in the spring, and obviously we'll keep our eye on our position in yellow to make sure that it doesn't worsen and we continue to get better, so we don't have to think about closing things that we've reopened, either on the business and economic side or certainly in education. And so based on the data, schools may reopen under scenario 2, which is the yellow. And again, it's a hybrid of mixed in-person and remote learning. So some students who will continue to learn at home with material over a broadband and with those devices that they have that enable them to do that. And then a mix of students who are coming to school, mostly, as we've talked to the school districts, mostly elementary school children, where the evidence is that the risk of infection is much less, and I think the challenges in developing the precautions in each of the schools is a little bit, and those organizational logistics, operational logistics are easy to achieve. So schools may use, under scenario 2, a hybrid of remote learning and in-person learning while following the precautions that the doctors Rick are going to talk about, Dr. Pescatore and Dr. Hung, in a minute. We've said last week that we'd like to test all the educators and staff, and there'll be testing available for students as well prior to the school year and throughout the school year, and our Drs. Rick will talk about that as well. AJ and Dr. Rick and Dr. Hong and Dr. Pescatore have worked hard on this to have a system that we think is easily to administer, and teaching all the teachers and staff that will be going back to school buildings under the hybrid model. And as more teachers and staff go back into buildings, they'll be tested as well. And then testing those teachers on a regular basis after the school reopens, and then opportunities for students to get tested periodically periodically as well. We've made great progress. When you think about the previous 5 months, we made great progress in flattening the curve. We've showed you the diagrams of the data, the peak data in April in terms of hospitalizations, number of cases, all of those criteria and indices. And then as it flattened out, moving towards Memorial Day, we did, unlike many states, have continuing improving conditions in our state for better than 14 days as recommended by the Centers for Disease Control before we went into phase 1 and started to reopen sectors of our economy. Did it gradually, reopened sections of the economy, restaurants, retail establishments, and others in a way that was safe. Continually, we hear from the White House Task Force that the outbreaks that states are encountering in Florida, in the Southeast and Southwest, Florida, Texas, Arizona, are a function of places where people congregate in bars and restaurants in particular, and doing so without wearing a mask. So wearing a mask is the most important thing that we can all do to help get as many children back into schools as possible and getting in-person instruction, recognizing that we don't want to bring children into the schools if it's not safe to do so. And so to talk a little bit about the process that led up to the original recommendations for green, yellow, red, and the precautions that schools would have to take to welcome students safely back into the schools. Dr. Susan Bunting is here, Secretary of Education for the state of Delaware.
Thank you, Governor. Much work has happened in the last nearly 5 months that has led to today's decision. We, back in March, had the opportunity to suddenly face a crisis we'd never faced before. On March the 13th, our students left, and about 7 o'clock that evening, the decision was made and announced that we, after looking at statistics, and we have relied frequently on the statistics and the advice from DPH, but we decided to close school buildings for 2 weeks. About 2 weeks later, we realized that this was not going to be an immediate change in the health situation here in the state of Delaware, so we had local districts and charters design guidance for remote learning for their students for the immediate. But this was a sudden pivoting of our teachers into a new world. We later in April knew that we were going to really need to stick to those plans and increase those plans for a longer period of time. So we did require that those plans be finished and submitted to the Department of Education. On April the 24th, conditions still warranted our deep concern about bringing students and staff into our buildings, and so we closed the school buildings through the rest of the academic year. We then began to think about what comes next. So on May 18th, we invited and were very pleased to have a group of Delawareans agree to begin to formulate plans for the future through 3 working groups, one on health and wellness, another one on academics and equity, and a third one on operations and support. And we had community members, educators that were from the teacher ranks, from the administrative ranks. We had administrators from other organizations. We had legislators, health professionals, all joined together to come forth with recommendations under the 3 scenarios that you earlier heard described. The results of their recommendations were compiled and put out on July 15th as a guidance, and those have been instrumental in where we are today, leading up till today's announcement to take a really hard look at what the guidance is recommending, and in combination with what we're learning about our health situation here in Delaware, make the decision that we can open schools under scenario 2, which would be that combination of in-person and remote learning opportunities for our students. The next steps naturally would be for the local districts and charters to decide exactly what plan would be best for the students and staff in those particular local education agencies, and those plans are now being finalized. So many, many thank yous to the Delawareans who have pitched in to date, and those who will be finishing the decisions in local districts and charter schools about where we go from here for the opening of a learning year, which will be very different from ones that we've had before. We also want to express our gratitude to the department that handles the technology. DTI here in the state of Delaware has been a constant companion, because one of the early challenges that we had was that many of our students did not have access to the internet, and many of them did not have devices. So we have been working with the Department of Technology and Information hand in hand to increase internet accessibility throughout the state. We invested, along with the governor's office, a segment of our CARES money in facilitating the building of towers on the western side of the state in particular, and we are in much better shape today than we were when we had to suddenly pivot into remote learning situations back in March. We also want to accent the need for the delivery of not just instruction through technological devices and the internet, but also the support that our students need. We're talking about related services for our special needs students. We're talking about mental health supports for our students, work that guidance counselors do, work that our social and emotional support personnel do. So there are many things that we need to be working on with our students in addition to what they're academically able to do and being challenged to do. With all that in mind, I know there's still a lot of questions, and we are trying to answer many of those questions through our website, and we want you to take a look at the one that would be particularly related to the health concerns that many of our staff members, our parents, our students have asked about what happens next. So as we look at a new school year opening around Labor Day, and some of those dates have been postponed a bit so that we can get further training for our teachers and really take a look at curricula that would be stimulating and far more content-oriented. We will advance into the next school year with the determination to make sure that our students have a full year of new learning. So with that, I recommend that you often take a look at the answers and resources that we have on our websites, not only for the state and the Department of Education, but also the local districts, where many of the frequently asked questions are to be found, and those websites will be updated consistently. So with that, Governor, I turn it back to you.
Thank you, Dr. Bunting, and thank you for the really good work that you and your staff at the department have been doing, working with districts and teacher groups, with the working group that came up with the framework for this, the green, yellow, red framework, working with the Division of Public Health around the protections, now the frequently asked questions. I said at one of the press conferences probably a month ago that by the beginning of August, it's August the 4th today, we wanted to have the decision as to what scenario we would be in. We wanted to push it off far enough that it was close enough to when districts were thinking about opening schools around Labor Day. Districts are making decisions on that to do it mostly a little bit later so that they give them a little more time to answer some of these questions, to answer questions about how they prepare the schools with the configurations and operational needs in terms of transportation, classroom configuration, curriculum, just like you said. And those districts are working very hard. They have large groups that are working in a team kind of way as we talk to the superintendents on the phone on a weekly basis. I was on the phone again with the nation's governors earlier this week, and each of them have been moving towards reopening. Some of the other states are moving ahead sooner than others, some more gradually, and it's a mix. And I think that the bottom line, as I've talked to the school superintendents over the last couple of weeks, is there's not one size that fits all. And that's because every school district is a little bit different number of students, a different configuration in their buildings, different capacity in their buildings, school transportation and the capacity that they have there. It's actually one of the limiting factors. If you're spreading children out and only bringing in smaller cohorts, you need more buses, you need more personnel in classrooms. And so each of the school districts are working through that with their teachers and staff, and I think doing a really good job of figuring out how to do it and to do it safely. We don't want anybody to come back if it's not safe, and that's why the people of public health are here with us today. We're going to talk about testing, going to talk about protective measures. They're going to talk about the things that each of the school districts are working on and have been working on, frankly, over the last several weeks, knowing in advance that this was a likely scenario and the different things that they had to do to prepare their classrooms to receive some groups of students for some period of time. And so we'll continue to work through this as schools gradually reopening. It's very much like the way we reopened sectors of our economy in terms of allowing restaurants and bars, for instance, to open to a certain capacity of their fire code capacity to provide some safety and to allow them to get back in business after having been shut down for several weeks. And we continue to look at that across our state and do it based on the data and the science, the situation on the ground in terms of our estimate of the spread of the virus in various communities, and that will continue to be the basis for our decision making. So one of the two people that help us with that advice based on the science are Dr. Rick Hong and Dr. Rick Pescator. And Dr. Rick Hong, you're on.
Thank you very much, Governor. In my presentation, I'll be reviewing the school reopening gating criteria, as well as offer recommendations for environmental safety within the schools. So many of us are familiar with this chart. It shows the gating criteria for the reopening of schools. We list 3 metrics that we're trending to determine what scenario we should be in. Again, they are new cases per 100,000 population, percent persons testing positive, and average daily hospitalizations per 100,000. And again, as already reviewed, you have 3 scenarios, red, yellow, and green. The scenario is determined by 2 of the same color. And if so happens you have 1 of each color, then the percent persons testing positive will determine the final color. So we're going to look through the history of our metrics. You know, no surprise, initially during the spring, we were in the red. That's during the height of the pandemic, especially here in Delaware. As you can see, as we're progressing, we're pretty steady in the yellow category, specifically for new cases, as well as percent persons that test positive. But looking at average daily hospitalizations, we've been green since mid-June. Also noting at the bottom of the chart, the last week our metrics were 2 yellows and 1 green, and as a result we are recommending the yellow scenario number 2. So risk assessment is really the key to this. Risk assessment guides our approach, guides our recommendations, guides our guidelines as well too. All school districts and charters have been assigned a public health liaison to support reopening plans, as well as to offer technical assistance and overall support for the schools during this process. We are providing recommendations from a statewide perspective using the 3 metrics. However, we understand the importance for individual schools to consider their own situations, specifically for their operations as well as their planning efforts. So the decisions on the learning format is really based on the individual schools. We are recommending a hybrid model, which is a mix of both in-person learning as well as remote learning. However, the schools feel they cannot provide a safe environment for their teachers, staff, and students. They can opt to be more restrictive, which would be scenario 3, which would be remote learning 100%. However, at this time, we would not recommend going the other direction to scenario 1 and provide 100% in-person learning based on what we're seeing in the state at this time. In terms of tracking, as you notice in the previous slide, we do track these metrics on a weekly basis, but we don't expect the schools to react on a weekly basis. As mentioned before with the quarantine list in other states, it's very dynamic. One time we're on, the other time we're off. So we really want to look at steady trends using the 3 metrics. If we are noting a significant difference in the trending, we will communicate that with the schools and then work collaboratively to find out what next steps are. Comment on environmental safety. Again, we want our teachers, our staff, our students to be safe within the school environment. So I'll touch upon several topics: the health screening protocols, infection prevention and control, social distancing, as well as facility management. So talking about health screening protocols, we are urging assistance from students, families, and staff to perform self-assessment daily to check for symptoms, a temperature check, checking for symptoms that might be concerning for COVID-19. If anyone has any of those symptoms or concerns, the recommendation is to stay home. If you are sick, please reach out to your family doctor or medical assistance as needed, and finally to get tested for COVID-19. Schools should have an isolation process in place if a student or faculty member or staff develops symptoms while on school grounds. Schools should create a separate area for sick students to wait for parent pickup. They should not be cohorted with non-sick or well students on a bus. So there should be alternative measures in place to transport them home. Also, final word on face coverings. Again, can't emphasize the importance of face coverings. They are required for grades 4 through 12 and strongly encouraged for K through 3. If there are any schools that are interested in increasing compliance or increasing use for staff coverings in those grades, please reach out to us or our public health liaisons, and we can provide technical assistance and guidance regarding that. Again, infection prevention and control face coverings, again, repeated for purposes of showing the importance of that. As discussed last week in determining guidance for quarantine for close contacts, the use of face coverings is a critical component to that case investigation, contact tracing. Recalling the scenarios last week, the appropriate use of face coverings, which means covering the nose and the mouth completely, will decrease the need for quarantining of close contacts. In terms of other pieces of equipment for protection, gowns, gloves, hair or shoe coverings are not required for general interaction or general contact. However, this does not apply for nurses who may be at higher risk if they are in contact with symptomatic students or others that they may have different requirements for personal protective equipment. So I just want to kind of separate the differences between the two scenarios. Very important with hand washing and hand hygiene, recommendations to schedule hand washing for teachers and students. And if students are changing classrooms, then the recommendation is to wash or sanitize hands between class changes. Next slide as well too is talking about social distancing. Again, a tremendously important part to overall infection prevention and control. 6 feet is recommended as much as possible. Other advice, use individual desks versus sharing tables when possible. Make sure the desks are facing the same direction. In terms of hallway traffic, and you see this at many stores out there, that there's one-way flow or one-directional flow in the aisles. We will recommend the same thing for the hallways within the schools. On each side should have one-way or one-directional flow on each side of the hallway, as well as to keep 6 feet distance between students if all possible. Talking about phys ed, try to design a phys ed curriculum, include activities that will support social distancing, reduce mixing of classes as much as possible. This is included in the CDC guidance for school reopening. They recommended that cohorting of students is preferred if possible, again, to reduce the chance of transmission, keeping the same group of students in one area. Should also consider limiting visitors, including families, as well as really no field trips at this time. And just a final word on facility management. Received many questions regarding appropriate decontamination and cleaning of facilities. Recommendations to clean and disinfect high-touch surfaces or common areas such as railings, doorknobs, and bathrooms at least every 15 minutes, but at most every 2 hours. A lot of discussion about air movement and filtering the air system. So you want to check your HVAC systems, change filters regularly. You want to ensure classrooms have waste baskets, tissues, appropriate disposal, as well as hand sanitizers. Again, CDC, you can keep up to date of updates regarding that. You also want to consider increasing ventilation if all possible, so weather permitting, you can open windows. And then finally, the use of outdoor spaces as much as possible, talking about recess, outdoor classes even, to try to limit spread of disease. And that's pretty much it. Thank you.
Yeah, so thank you very much, Dr. Hong. One of the things that Dr. Bunting mentioned was the resources that were made available by the federal government, and we want to thank our congressional delegation, Senator Carper, Senator Coons, and Congresswoman Blunt-Rochester. With the CARES Act funding, about $38 million or so went directly to the districts for a lot of the things that Dr. Hung just talked about, and another $12 million went to the executive branch department to distribute among the districts based on requests and their needs. And I know that from our conference call with the National Governors Association just this week, that the discussions happening in Washington right now would provide additional resources for a school reopening. Testing is an incredibly important part of our response to COVID-19. It's been incredibly important for our approach to making nursing homes safer, and it will be an important part of our approach to reopening the schools. Dr. Rick Pescatore is here to talk about the testing plan that we've developed. I must say that we will be joined in the plan with our county executive, Matt Meyer, who has resources from the federal government as well, and has been helping with testing here in Newcastle County, and will be part of our effort here with the schools testing. Dr. Pescatore.
Thank you, Governor. I appreciate the opportunity to talk about testing, which I agree is incredibly important. And I think it's important. What we talked about a lot here was synthesizing testing within all the other keys to reducing spread, which is certainly everything that Dr. Hong spoke about, but also nesting testing within testing in the community as a whole, which is really where this begins and is such a key to reducing spread. As we look toward testing for schools, when we look toward testing for teachers, students, and staff, I think it was important for us to understand that we needed to leverage new testing options and new testing availability, whether that be reagents for collection, processing, lab processing, results delivery, and in concert, just as you say, with the Newcastle County government and A.J. Shaw at DEMA, we were able to purchase 20,000 new tests of what I'm particularly excited about, which is the Vault Health saliva-based test, which we look forward to using as a key component to getting teachers and staff tested as well as students. This is an exciting opportunity. Vault Health provides this saliva-based test as a test that's actually performed within the home. It doesn't require a separate physician's order. It can be done whether there are symptoms or no symptoms. And essentially a link is provided to a staff member, a teacher, and the test kit is shipped directly to the home. The cost has already been prepaid by the state. That includes the kit itself, as well as processing, as well as the shipping costs, as well as sort of the process of collecting the test, which we'll talk about in a little bit. One of the important things about using the Vault test is that it is an augmentation of the community testing which is already in place, which is to say the curative testing sites, the Walgreens testing sites, the incredible work that's done by the hospital sites throughout the state, the community testing partners, and leaning into that a little bit, identifying the success we've had with so many of those community testing sites, we've identified as that is an excellent opportunity to get students tested as well. And so what we'll be looking toward is community testing sites that are high throughput and geared particularly at getting as many students tested as possible, all of those who wish to be tested, and certainly encouraged as highly as can be possible prior to schools reopening. And what we'll do is provide those community testing sites in addition to the variety of community testing options which are already available, and those will be set up so that they can process and deliver results for students across the state and deliver results in time for schools reopening to ensure safety. And when we look at the option for staff testing, I want to talk about it a little bit because I think it's a little unique from anything that we've approached before, but I'm pretty excited about it, and I think it is an excellent opportunity for teachers and staff. What we'll be offering to teachers and staff is done in the home, it's done electronically, it's done through a Zoom call. Where after staff and teachers receive a code, they insert that code into the computer, a prepaid UPS envelope arrives at their home, they perform the test through that Zoom call with Vault staff and physicians, and then they drop that kit back into a UPS drop box or other UPS location, and the results will be sent to them in 48 to 72 hours by both text and email, whichever is made available by the person performing the testing. Vault also has its own dedicated call center and support set up. So they are dedicated to provide that support for all who need it to perform this testing. I think that this is a tremendous addition to the community-wide testing, and we still have that availability for our curative sites, our Walgreens sites, our hospital sites in cooperation with the hospital partners throughout the state. And then looking at those DEMA and DPH-driven drive-through and walk-up sites for students, which uses this vault option as well to leverage a sort of variety of testing availability throughout the state to make sure we don't run into any lab processing bottlenecks, and to be sure that this is not a departure from what's available, but simply in addition to all the different options we have available through the state. And I think that brings us to kind of a quick summary of where we exist for community testing options for everyone. That remains the curative drive-through and walk-up sites, which have been done fantastically by DEMA as well as Newcastle County, and thousands upon thousands have gotten tested. Our Walgreens sites, which will continue to expand the fantastic work that's been done through hospital and community partners throughout the state. And then adding in this vault option, I think, provides an outstanding option for testing availability for students and teachers. And it will begin with that large volume testing of students and teachers. We'll continue to have that option available to augment community testing for students throughout the school year. And what we'll also be doing is providing a setup such that teachers, about 25% of those teachers will be tested each week to target that once a month testing available for teachers. I think that it's really important. We've talked a lot about all the different legs of the stool that go into safety to ensuring that we can get people back into school safely. Testing is an important component of that school. It's an important leg of that. And by utilizing this vault option, which, endless thanks to the work that was done by Newcastle County, by DEMA, and by all those who were able to identify this option and get it mobilized, we're going to be able to help people know their COVID-19 status, continue to have access to testing throughout the state, and keep everybody safe.
So great presentation, Dr. Hong, Dr. Pescatore. Thank you, Dr. Pescatore, for presenting and talking about the evolution of testing here in Delaware over the last 5 months, because it's dramatically different than it was just 5 months ago, when we were really just testing people who had symptoms and were referred to the hospital test sites. Hospitals did most of the testing at that time, and they were tremendous partners in doing that. Early on in our White House task force calls, Dr. Fauci and Dr. Birx in particular mentioned that she was a strong believer that there would be breakthroughs in testing methodology over the next several months. And this proposal, this plan to test all teachers, all educators and staff as they go back to school, is an indication of the improvements that have been made with the vault testing that can be done at home, securely, safely, confidentially, with those teachers, that can go back and be used to test teachers periodically after the initial test, so that we can again have that comfort level and confidence that it's safe to go back into classrooms. You mentioned the curative tests, and A.J. Shaw, as a point person in this, I asked him a month ago that I wanted to see all the teachers and educators tested before we open the schools, and this is the way we're going to do that. We also, and he's also been leading our community testing. You mentioned the other partners, and I think importantly, we had, just as an example of how this can work together, we had several very successful community testing sites in the Laurel area going back several weeks, and the turnout was quite good. The percent positive was quite good as well, meaning that we didn't see a lot of positive cases. And then it kind of fell off. We didn't get as much, I think, publicity for the testing site. Only a couple hundred folks turned out. I talked to Mayor John Swed, the mayor of Laurel. He talked to the Sean Larmore and the folks at the school district, and they got a lot more people out. A lot more were tested. Again, the positive rates were very good. It shows up on our Healthy Community website, and it gives the residents of that area a level of comfort for what the spread is like there as Laurel and their school district look towards a hybrid model of moving back. And so testing is just an important part of that, just in terms of containing the spread, knowing where it is, and providing a comfort level for teachers, staff, parents, that it's safe to go back to school in this hybrid kind of way. So to AJ Shaw is not with us today, to all our partners, to you, Dr. Rick and Dr. Rick, thank you for this plan. I think it's going to serve us well and serve the schools and the districts across their state well, too. So that should be a little bit of a commercial to everybody across our state. In order for us to manage COVID-19 and the spread of it in Delaware, we need folks to get tested, whether you have flu-like symptoms or not. You know, we need a broad base of geographically of folks that are being tested. We're still approaching our goal of 80,000 tests a month. We knew that would be a stretch goal, and it has been. We've approached in around 15,000 a week from time to time, and continue to strive to do that and to get the kind of. But what happens is people get a little complacent. They see maybe that the spread is not as great, much like the experience that we had that one testing site in Laurel a couple weeks ago, and then when folks leaned into the publicizing the availability of another site, we got many more people out to get tested. So to everybody out there across our state, take advantage of the community testing sites, the curative sites, take advantage of our partners at Walgreens, take advantage of our partners in Newcastle County, and certainly you can get tested from your physicians and in the hospitals as well. So again, so know your COVID-19 status and help us contain the spread in our state. And so that's our presentation for today. I want to thank again the media for attending. I know we had a few questions that came in advance, but looks like we have someone here in person to answer questions.
I'm back.
Ask questions.
With in-school instruction, does the state have a limit as to how many students can physically be in the school? I'm thinking X percent of the student population for a particular school.
So I'll turn it over to one of the doctors, Rick's, but it in part depends on the geometry and the space in the school. And that's why I said that every district is a little different. Every school is a little bit different. And there's no one size that fits all. Dr.
Yeah, so that's correct, is that there's no hard pass rule, it's an X percentage or something like that. It's really based on the facility itself. As long as they are able to meet the social distancing recommendations, the infection control measures, that's really going to determine the census of the schools.
And so will the schools be reaching out to the parents about if their child should do virtual or in person?
Well, we know that they're doing that. And obviously it's a good thing to do. I mean, this is kind of a joint exercise, excuse me, parents, teachers, superintendents, education leaders, state, public health, all of the above. And the superintendents have reported on our phone calls the results of those surveys. I think it's fair for me to give you an example of one that was just reported. I won't mention which one it is, but they decided that they didn't have the space, the geometry to meet the social distancing requirements in their upper grades, and so they focused on the younger grades to do that. They polled their parents and found that some percentage of the parents wanted to complete remote learning, and some wanted strongly to be in schools, and so they focused on getting that percentage of students in classrooms where the parents wanted the children to be there. And I've heard similar kinds of stories. Dr. Bunting, if you want to comment on that.
I might add that parents have often been involved in the local design of plans. I think there's been a community effort since the districts began to work on what would happen if we were in scenario 1, scenario 2, scenario 3. Just as we had 3 groups working at the state level, many of the districts had similar groups that were designing the plan for that particular district. So parents have had a strong voice, and they will continue to have a voice and have choice.
And by the way, we've had communications on our regular calls with the charter school network, and I've also spoken to the leaders of the Catholic and independent schools, and they've done similar things in surveying their parents in terms of remote and in-person instruction, and tried to accommodate the desires of each of the parents.
And when remote learning occurred this spring, there were reports and concerns about attendance rates of that online and virtual learning. How does the state, and I guess subsequently school districts, plan to enforce attendance, and I guess at the most extreme level of truancy, considering the new era that we are in?
We're having those conversations now, and we've had a group, it's an assorted group that has been talking about all the challenges that we have been having. They've actually been meeting since March 16th. They will have some conversation about what is attendance when you can't see the child in front of you each day, but ultimately that's going to be something that the districts have to decide how they will do it. Obviously, if the child is in school or not in school, you can see him. If it's a remote situation, there'll be a way of knowing the child is participating. And then we have eSchool. That is a system throughout the state that tracks data, so it will have to be recorded daily in our eSchool system.
And finally, just about staffing, is there any concerns about teacher staffing? I'm thinking teachers who might be older or immunocompromised, concerned about being in the classroom, and what about substitute teachers in the case that teachers do get sick with the coronavirus?
I think we are all concerned about those people, be they students or teachers, who might have some compromising situations. And usually the district is working with the staff members to see if there are situations of that nature. And that's often something they're working through with their local union members. But naturally, we need to take account of those people of whatever age that do have challenges physically or other reasons that they could not be there. They also might be someone who could become a remote learning teacher on a regular basis. So staffing decisions will have to be made locally as well.
That was one of the things that we heard on our regular calls with the superintendents, is to make those accommodations for the teachers that maybe are a little bit older, have health conditions that are concerning, that they could be the teachers that do most of the remote learning interaction with the students. But to make some kind of accommodation there.
Can teachers choose to just solely do remote learning? Is that a possibility?
Well, I think it's a district by district and a contractual kind of thing. But the idea is to recognize the special circumstances there and make some accommodation within that contractual relationship.
Hi, Governor. Quick question with regards to the testing. You mentioned that the goal was to have the teachers, or the educators, I should say, staff and teachers, tested once a month using the Vault system. With the students, is there like a frequency goal there as well? Once a month, once a week? And then as a quick follow-up, any plans or efforts to monitor that, potentially enforce students to do that if they are not doing it voluntarily?
Turn it over to the doctor, Dr. Pescatore.
Sure, I think it's an important question, and we want to encourage everyone to test frequently. Our general guidance for most of the public speaks toward getting tested around once a month. And when we look at testing for teachers, by leveraging the Vault option, we're able to increase availability for that to ensure that there's access and that they can get those tests done. When we talk about testing on a whole, it always returns to that community testing availability, increasing testing for the entire community, including students. And so what we're going to continue to do is increase that testing availability, and that includes the curative sites, the Walgreens sites, as well as making that Vault option bigger, making that Vault option available to the community as a whole so everybody can take advantage of it, teachers, students, and the community at large.
But I'd like to comment that the importance of testing is there, but we also need to make sure the infection control measures are being complied. So if we are not social distancing, we're not wearing face coverings as appropriate, we're not performing appropriate hand hygiene, testing doesn't matter because the infection is going to spread. So we want to reinforce that testing is just a piece to the puzzle, so to speak. So social distancing, face masks or face coverings, as well as hand hygiene, and of course, more importantly, contact tracing if we do discover a positive case.
Other questions?
All right, this question is from Tim Mastro at Delaware State News. How are the weather cancellations affecting access to testing? Have recent participation numbers been affected by either extreme heat or storms? And what are some things people should know about what happens if their test gets canceled?
So I know the testing site that was scheduled for today was canceled because of the storm that came through. They did have some lower numbers of folks that turned out to the testing sites on the days that were way up in the 90-degree temperatures. But overall, on a week-to-week basis, our testing numbers are quite high. I don't know what the answer is to if the testing, like what happens if you were scheduled today. I'm not sure what AJ's plan is for that. I'm looking to, do you know, Dr. Hahn?
Yeah, so, and Dr. Questor is the testing expert here, but they just have to register for another testing event if they were talking about an event that required a pre-registration process.
Yeah, we do manipulate capability. When we talk about any site, whether it be Curative, Walgreens, one of the limiting factors is always lab processing capability. But if there's a day that we don't do testing, it increases our ability to sort of meter out processing over the subsequent days. So DEMA's been incredibly responsive in getting testing available when increased testing sites were needed. But I would echo it completely that if your test site gets canceled due to the weather, seek out another one the next day. Go to de.gov/get-tested for the variety of testing sites that are available throughout the state.
The next question's from Melissa Steele at Cape Gazette. Will the state consider offering a reputable K-12 online curriculum program for students, similar to what Pennsylvania and other states offer?
I'm not acquainted with what is offered in other states as far as that online system. To date, we have not been asked about doing that. We are a support agency, and we've been working all summer with various groups and also with individual districts on curricular materials and trainings and so forth. We do expect to have a rigorous curriculum in each district and charter that would be reflective of the state standards, and we're working toward that in a collective manner. But as I mentioned, to date, we haven't been asked to look at that particular kind of online curriculum. And since we do have local decisions made about curriculum and instruction in our state, I'm not anticipating one for the upcoming school year.
All right, 2 more questions. This is from Peter Osborne at Delaware Business Times. We had several questions about if certain % positive of students test positive, will the school move to 100% online learning?
I think we need more information than that, but Dr. Hahn?
Sure. So, looking at the entire population of students and just taking a percentage, as an epidemiologist or looking at case investigations, contact tracing, we would need to know the locations of these positives. I mean, there is a big difference if the positives are located in a local area versus statewide. So as the governor said, that we do need more information, and hence this makes it so difficult because there's really not a trigger to result in a response. So we have to really look at each case individually and make the best recommendations based on the risk assessment.
The next question's from Peter Osborne at Delaware Business Times. What are your thoughts about the concerns that teachers have if they don't want to return to the classroom?
I understand the concerns that teachers have. They're really important in order for any of the hybrid models, any of the in-person instruction to work. Teachers need to feel comfortable that it's safe. And all the teachers' groups and individual teachers and others that I've spoken with, they've all said that they're eager to get back into their classrooms with their children on a face-to-face basis as long as it's safe to do so. And that's why I think it's our job, my job as governor, the job of the folks at the Division of Public Health, to show that we can do it, and we can do it in a safe way so that teachers and staff, educators have the confidence to go back into the classroom. I think the way that each of the school districts are doing it gradually, to think through and to implement the protections that are being recommended by public health. I think our effort to test all educators as they go back into schools, to periodically test them after that, as well as children, will help give teachers, parents, and everybody the level of comfort that is necessary to make this successful. We have to address those concerns in order for it to work.
Hi, I'm Amanda from WITN. I just wanted to ask a quick question about special education students. I know that there's going to be a lot of challenges in this upcoming school year about, adhering to IEP standards and things like that. What are the plans, and I mean, maybe they're specific to the districts, but what are the plans to ensure that these students are getting the services they need, as well as maybe tweaking the IEP standards a little bit to ensure that they're still getting maybe even compensatory services?
I'll turn it over to Dr. Bunting. This is her area of expertise, but I can tell you that it's been my view that this is an area where we really need to lean into to make sure that these children who have these learning challenges get what they deserve. And there are certainly advocates out there that are pushing for that, again, to do it safely. And that I know districts are looking specifically about how to do that and what the challenges are. With respect to some of the technical aspects of your question, Dr. Bunting might be able to answer that.
We still have the responsibility to deliver on a free and appropriate public education and adhere to the IEP. And you do have your staff that is not just the classroom teaching part of that staff, but you also have the support personnel, the related service personnel, all of whom will be working and figuring out very creatively how to address those needs. It may not look exactly like it looked in previous times, but to change that IEP, to tweak it, would involve involving the parents and redoing pieces of the IEP. So I think districts are working hard to do their very best to deliver on what has already been prescribed, and that is a major concern of ours.
Thank you.
Thank you very much, and that's the last question. So our press conference has come to a close. Once again, I want to thank everyone for joining us today. In particular, I want to thank the school superintendents and their staffs, their teachers, educators across our state for the important work that you do, for your engagement in this issue as we work together to try to reopen our schools in a way that's safe for students, that's safe for teachers and staff, and to do it based on the science and based on the recommendations of Dr. Pescatore, a great testing plan. Thank you for that and the work that you continue to do. Dr. Hong, the state's medical director, for your advice all along the way. To all of the public health professionals who have been assigned to work with each of the individual districts, we appreciate your work. This is August the 3rd. We still have a lot of work to do. Most cases we have over a month, I think, before the earliest that schools are thinking about bringing some of their students back to classrooms, again, in a mix of remote and in-person instruction. And I'm very confident that we can do it and do it safely in the best interest of our children. All the rest of us, we can help. We can help by, again, trying to flatten that curve, by being cautious, by wearing face coverings, face masks, by getting tested, by exercising social distancing when we're in public, particularly in establishments where there are lots of other folks. We can help send our children back to school safely and to enable them to move throughout the year as conditions on the ground improve and get healthier. So thank you for joining us today, and we look forward to seeing you the next time.